This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So as you can probably tell from the picture, we're a pretty chill group. So this is going to be fairly informal, just kind of outline everything. I'm Tyler. I'm one of the chief residents for the UAMS PM&R program. We'll have lots of pictures and a few details and then try to save some time for questions. So just wanted to say thanks to PM&R Scholars for throwing this together again. I'm one of the classes that really had to use online resources a lot to vet some of the programs and decide where to apply because I was coming out during the time of COVID. So it was really useful for me. I definitely learned about some programs that weren't on my radar before, ended up applying, and I ended up putting a few pretty high on my rank list that I really wasn't anticipating. So I hope that's the same experience for you all, and maybe we can be that program for you. So again, my class came out during COVID, so don't judge us for not having a good group photo, but this is our PGY4 class, PGY3s, 2s, and 1s. We take 4 residents every year, and we're a pretty tight-knit group. We've got an interim chair right now. Dr. Barnes is a hotshot. He is an orthopedic surgeon, but we are currently looking for a PM&R chair, but we are affiliated with the ortho department, so it works out well. Dr. Gardner is our program director. She is wearing a little green brain injury awareness thing because she's a brain injury specialist. And then Tamara is our program coordinator, and I believe she's on right now. This is just our core PM&R faculty, so pretty small like core faculty through UAMS in the top row, and then through Arkansas Children's Hospital in the bottom row. Dr. Lambeth just started, that's why her picture does not match yet. We also have quite a bit of adjunct faculty through our like VA location, through some of our clinics across campus and across town. So we work with like some family medicine trained sports medicine physicians. We work with a lot of PM&R, pain, EMG, all kinds of people at the VA, et cetera. So there's a lot of people not depicted, but I would say we get a pretty varied experience with a lot of different faculty. Just quick facts about the program. We are a categorical program, which is very nice, especially if you're trying to couples match or not trying to do a TY or prelim year. We have in-house call, which I think is probably underrated among med students, but the really nice thing is there's no workaround for like ACGME requirements. It's like if you're on call, then you get the day off. That's just how it works. You always get your day off, even if you don't get a lot of calls and you get to sleep. So then sometimes you're getting extra days, which is super nice. All of our rotations are in Little Rock. Driving time is pretty short. We've got a map coming up here, so I'll show you some of the different clinical sites we spend a lot of time at. And our blocks are 3 months long. So it's actually really nice because by the time you get to the end, you're actually pretty much doing everything on your own, and you've really gotten a workflow and get into a routine and like get your schedule set. So I kind of like not having all of the transition. So that's from our PGY 2 to 4 years. Intern year is a little bit different, obviously, with all the different rotations that you have to get in for ACGME requirements. So here's a map with our clinical sites. So this is our primary rehab hospital here. It is through the Baptist Health System, which is a private nonprofit health system. Here is UAMS, which is our core academic center in Little Rock. And then here is the VA hospital. These two actually share a campus. Arkansas Children's is over here a little bit further downtown. This is about 5 minutes. This is probably about 10 minutes. And I would say maybe like 50% of our residents and faculty live kind of in this area. It's nice, safe, affordable, probably about 10 minutes to here, about 15 minutes to here, and then maybe like 20 minutes, probably worse traffic, like 25 minutes. So very, very easy drive, very low traffic area. Other facts about Little Rock. So like this is Arkansas. Here we are in the South. Little Rock is like smack dab in the middle. So we literally get everything from the entire state and then some of the surrounding areas as well. Big kind of healthcare desert. So pluses, you're going to see a lot of things. Downside, obviously, it's going to be kind of challenging for your patients. But the good news is that really prepares you to kind of see everything. And we get a really good mix of, people who are like pretty well off and, politicians, sports figures, that kind of thing that are just seeking us out based on reputation. And then people like low income areas surrounding, because the academic institutions, of course, don't have as many restrictions for insurance. So they'll take Medicaid and things like that. So we really see the whole gamut, and we get a lot of different pathologies, a lot of different demographics, so really, really everything. We're about 200,000 in the Little Rock area. Metro area is a little bit bigger than that. Again, commute's really not that long. I don't even know about 30 minutes. I definitely don't drive 30 minutes, and I probably live a little further out than most. It's very affordable. This may be a slight underestimate with inflation going the way it is, but that's pretty ballpark. I bought during COVID. I have a 1,500 square foot house, and my mortgage is like $1,100 a month. So, you're probably not going to get the interest rate I got right now, but it's probably not going to be that much more than that. PGY1 curriculum. So we do 1 month blocks during PGY1 only, 3 month blocks the rest of the time. Even though we're a categorical program, I would say our PGY 1 year is structured more like a TY in that most of it is like actually rehab relevant, which is really nice. So we get things like rheumatology and neurology and orthopedics and PM&R and geriatrics, and that's more of like in a SNF/nursing home setting that you might actually, see later on. You do get your medicine requirement, and then you see EM, which I think is useful because so many of our patients are going to be coming through the ER with, polytrauma type of thing. So I think that's helpful. Cardiology, I would say cardiology and infectious disease are probably like the two biggest, hardest, like most difficult to manage complications that you're going to see in an inpatient rehab setting. Like you're going to see it a lot. It can really like mess up a call shift. Your patients can go downhill quickly. So it's really nice to be able to like read an EKG and be confident in that and manage diuretics well and stuff like that. So I think that's nice. The rheumatology rotation is kind of cool because it says it's through Baptist, but it's really like more of this private clinic that you're going through. So you kind of get a feel for what it's like to work like in a private practice and own your own clinic. So that's nice. And then radiology, I mean, it's a pretty relaxed month. A lot of our residents use this as a time to study for step 3. So we really don't have any issue like having enough time to like plan for, study, and take that. PGY 2 through 4, we do the 3 month blocks. We get a lot of experience at multiple different sites. We spend like almost a year at UAMS, either in outpatient clinics or on a consult service for the inpatient side. 6 months at Arkansas Children's. We spend like a year-ish at our rehab hospital at Baptist doing a combination of stroke, TBI, and our spinal cord service is like spinal cord, but also Dr. Kaiser will take pretty much anything. He also takes a lot of amputation. He'll take some cancer. He'll take, I mean, just, generalized weakness, sepsis kind of thing as well. But he sees pretty much all the poly traumas as well. So, I mean, it's a pretty broad service, and you end up doing that one twice. Usually the lower level and an upper level resident to get a little taste of what it's like to manage the team and kind of increasing responsibility. We do a lot of our procedural rotations at the VA, and you get really good volume there. You have no problem meeting your ACGME minimums. So we'll do an EMG block for 3 months there, and then you do a largely pain block there for 3 months as well. So I think, pretty good place to get experience because it's really, a system where you don't have to worry about insurance and everything. So, I mean, just huge referral source, and you got plenty of volume there. Here's just kind of some pictures of different sites that we have. We just got this nice new spine hospital. I wish this clip would play. This was, wheelchair clinic. Dr. Kaiser likes to race some of the people. So he was racing a medical student here. And this is the exact moment where the medical student realized he was not going to win that race. Dr. Kaiser turned on the turbo there. So we like to have fun with this. I think we get a lot of hands-on experience with things like this, and you'll see pictures like this where we're in didactics, learning about modalities, and we're actually kind of trying them out and like trying to understand like what does this actually feel like? Like what are we prescribing for patients? How do you like learn to drive a wheelchair? Like what are the different features? How, and I think getting some hands-on experience through our didactic curriculum is really nice because most of the time it's more of like an abstract, like I know what this should be used for, but like I don't know what it is experientially to have to use some of this stuff. So I think we get a lot of hands-on stuff that's really nice through that. We do get to rotate through amputee clinic, wheelchair clinic, private practice, the VA, private nonprofit hospital, academic center, children's hospital, satellite clinics. I mean, literally pretty much everything. Um, yeah, this is our Baptist Rehab Hospital. I'm gonna try to save a little bit of time here just to get some questions, but this is comprehensive, pretty much everything, largest rehab hospital in the state. We do inpatient and outpatient at Children's. It's a very highly ranked children's hospital. Our faculty like to have fun as well. Um, Yeah, VA. So it's a pretty large VA system. We have one in Little Rock and one in North Little Rock. So lots of like satellite clinics, huge veteran population in the area. So get plenty of exposure to that. We have mentor groups, basically just a way to like make sure you're meeting your ACGME requirements for QI, able to get involved with research, kind of get on projects, hear about different ways to navigate, applying for fellowship or, how to best prepare for certain things. So this is just a good way for junior residents to kind of get acclimated and plugged in, which is really nice. So there's like a formal way to do that rather than you just kind of floating on your own. And then Arkansas, I mean, it's called the natural state for a reason. A lot of what we have to offer is outdoorsy stuff. So if you're an outdoorsy person, it's a great place to be. We have a wonderful state park system. I mean, you can just look at all these pictures. I think all of these were either taken at a lake or a state park. We have Pinnacle Mountain State Park, which is where I think this and this was taken like probably 10 minutes from my house. I love going out there. It's a great way to forget about all of life's problems for sure. And we like to hang out as a group. So we get the big group together a few times a year for sure, but then, we'll get just individual groups of residents hanging out, all the time. So I think we're a pretty tight knit group. We like to have fun and definitely are pretty low key. So if, if you're looking for a program that's going to get you what you need education wise, but also not, really make you suffer, then I think that this is a program that you should look into. And we're happy to take any questions.
Awesome. Thank you so much. Any questions in the chat?
Yeah, that's a great question. Actually, I thought about mentioning this and kind of forgot. Yes, we do have several residents that have had kids. I think that's actually a really good question to ask in an interview setting as well, because I think it tells you about quality of life. We have one of our PGY2 residents who's a female that just had a baby. One of our PGY4 residents is currently pregnant and going to have a baby in the next month or two. Um, Last year, we just had like a graduating PGY4 that had a baby while in residency. And then one of our attendings had a baby as well. Like I think he was first year out and just had a kid. So definitely have had residents pretty much every year, at least one. So I think we would work with you to make sure that you get adequate leave and all of that. I think it's very family centric. Obviously, having a kid in residency is going to be a challenge regardless, but you can definitely do it if you want. And again, we're categorical. So if, family, significant other is important. I think couples matching, quality of life, those things are going to be something to ask about. And I think that we kind of check that box. Um, Actually, let me think. So I've been around the program for a while. I'm trying to think back. I believe we did have a US IMG a few years ago. I think it was when I was a medical student though, so I'm a little foggy on where they went to med school, but I believe so. You could ask Dr. Gardner to confirm that, but I'm sure at some point we've definitely had one. I think in the last few years we've had at least one though. And I don't know of any score cutoffs at all. I do know that like one of our residents from a few years ago, like barely passed up one before they did this pass fail stuff, and we actually got a score. I think he had like a 190 something, and it's fine. And I mean, he's great and he's killing it out in practice. I don't think we really care. It's more of if you fit with the program and you have good rec letters and do well on rotations and that kind of thing. Volunteer outreach opportunities. Okay, yeah. So we have like all kinds of sports opportunities. We do some sideline coverage. We have the Razorback contract in Northwest Arkansas, so if you like really want to go up there and get involved, you can. But that is a little bit of travel. We do have a local free clinic affiliated with the med school that you can get involved in. As far as like specific PM&R things, our faculty do things outside. So like one program we're affiliated with is Go Baby Go. So it like focuses on getting early mobility for kids, like usually in like the 2 to 6 year old range. So we'll go over there and like build out these like kind of toy cars, but like almost like custom, like you would a wheelchair for these kids. And then they get to test them out and kind of use that as their first mobility device. So we have lots of random things like that. I would say it's not like super structured, but it is very much create your own experience. So if you're looking for a particular thing, it probably exists, or probably you could figure out a way to be involved in that. But it's just kind of reaching out to people and figuring out what's available. Yes. And Kamari is also here. She's one of our PGY2s. So if you have any questions that, experience wise for somebody that's a little bit closer to where you guys are at, because it's been a minute for me, then she can definitely answer some of that. IMG friendly. I mean, like I said, I think we've had at least one from a U.S. Person that went to a school in like the Caribbean or something in the last few years. I really don't think that we have any like preference for where somebody's from. I think again, it's more about like fit and how you interview, that kind of thing. So I mean, definitely don't let it stop you from applying. I think everybody's gonna for sure consider your application the same as anybody else. Baseball. Oh, the AA baseball team. So the AA baseball team is in Northwest Arkansas. The AAA baseball team is down here. The like SEC college teams are in Northwest Arkansas as well. But like for example, they play some games down here. So actually, that's like where some of our residents are at right now. He was trying to send some pictures of the game, but it was not sending because they've got like I don't even know how many tens of thousands of people in that stadium right now. What are the requirements and expectations for residents? I mean, I think we're honestly like a pretty resident-led program. I think it's good and bad. Like we have a lot of responsibility for like making lectures and stuff. So we do M&Ms, we do anatomy lectures, we do case reviews, which is like prep for oral boards and all kinds of other things. A lot of the like direct patient care is us because our attendings may be like on an inpatient service, but then also have clinic during the day. So then they'll go do their clinic stuff, and you're largely like running the inpatient team. They're available via phone, but like, you're the first call for everything. So I think it's good because you come out really prepared. Now, is it more work for some of that? Sure. But I think it's more of like you're working during the day and not so much like working long hours because like I would say our hours are probably a little better than average. You offer away rotations. Yeah, yeah. So we definitely have away students. I think we've got 2 away students right now. So if you're interested in away, you can talk to Tamara and apply through VSAS. Okay. Oh, Emery's on here too. Sweet. So we've got a few residents that can answer questions in the chat. And again, I got those emails up. I'll put my email in the chat real quick. but I think we're running out of time here. So